Hello and welcome to the Quincy Access Television studios. I'm Mark Crosby. Thank you so much for joining me and my guest. My guest is Caitlin Kirby. She is a public health nurse in the city of Quincy, Massachusetts. I say that because we do have this program travel across the country, and we thank all those stations who do present it to their viewers. So today's topic is extremely timely. Here in the Northeast, we just had a major storm, which actually kind of swept the country. It didn't just affect the Northeast. So you thought, Caitlin, that staying active in cold weather was a good topic, and I absolutely agree.
Yes, and we're really just focusing on shoveling snow. It seems something that, especially here in New England, it's so common to us. You don't think too much of it, but it's a lot on our bodies. So I thought it was important to go over, if you have cardiac issues, ways to stay safe.
Absolutely. So we will start, as we normally do, with an overview. We will look at statistics regarding shoveling, snow, and cardiac events. How does shoveling affect the heart? Individuals at an increased risk. Know how to identify the symptoms of a heart attack or cardiac arrest and stroke, and what to do. Steps to make snow removal safer. And we will end with resources. Statistics regarding snow removal and shoveling.
So I found this very interesting. According to the American Heart Association, snow shoveling causes approximately 11,500 injuries and 100 deaths every year in the United States. And this is primarily due to heart attacks, especially among men. And heavy, deep snow, which is considered over 8 inches, increases the risk, with studies showing up to 34% rise in fatal heart attacks among men the day after a heavy snowfall.
The day after, so it doesn't necessarily strike you the day of.
It strikes you when you get out there in the snow to start shoveling.
Okay.
Because typically we got to let it pile up. I think we found that in this last storm, is everybody was out shoveling and it just kept coming down.
Often we'll hear about someone who has collapsed outside while shoveling, and that's when it really would happen. I suppose it wouldn't happen when you come in from shoveling. At least if it did, it would happen immediately and not hours later. There
are symptoms that we'll cover to look out for, and if they don't go away, then you're advised to call 911.
Okay.
And it's very important because, especially in these big snowstorms, it's only emergency personnel on the that can be on the roads. But if you think about it, it's hard because if you're out shoveling and you have a cardiac event, it's not as easy for an ambulance to get to you because of the snowfall.
True.
So it's scary. So I think knowing your risk factors and when to hire somebody else, which is very great in today's world. I know many people in my family especially who have snow plows. So it's important to know when to hire outside and not risk a heart attack.
Years ago, and it's not so popular now, children would be outside playing in the snow and maybe shoveling a bit too. And it was easy to just go up to a neighbor's house and ask the children if they could help you shovel, or maybe could do the shoveling for you. And beyond that, often kids used to take shovels and kind of walk the neighborhood and shovel folks out. Unfortunately, that doesn't happen too much anymore.
Yeah, I actually did have that happen last year. A couple of kids came by and knocked on the door. So definitely it's wonderful, and it gets them out there, gets them helping others, which is good. But it's just, you got to think, especially depending on how much snow we have, although it's light, fluffy snow, it gets very heavy and is a lot on the body.
So I guess we'll probably get to this, but maybe if you don't have someone to shovel for you, then maybe you go out periodically during a snowfall so it doesn't accumulate that much.
Yes, that would be a good way of pacing yourself.
Right.
Is really, yes. That's definitely a good tip to follow if need be.
So let's talk about how shoveling affects the heart.
So, snow shoveling is primarily involves isometric or static exertion, which means the muscles contract without significant joint movement. The activity relies mostly on arm muscles, which place a greater strain on the heart compared to leg work. In lifting heavy shovels full of snow often leads to unintentional breath holding, which can cause a sharp increase in your heart rate and blood pressure.
So would you suggest not filling your shovel full of snow, maybe filling it halfway?
So and also pushing it rather than like taking a pile and pushing it back. Like if you can push it off to the side and leave it on the ground,
Right.
To collect it. That's also a good way. And definitely instead of just your arms, use your legs to push and really give you that momentum.
And I suppose, and again, we'll probably get there, but this just comes to mind now, especially with this latest snowfall, the piles are huge. So if you're lifting and throwing it even higher and higher and higher in one general area, spread that out. So even if you have to walk a few steps to put the snow in a different place, it's better off than trying to lift above your head.
Yes, yes. And it's all about knowing your limits. And if when in doubt, if you can always call the city to see wherever you are living to see if they may help. For example, like elderly in the community, if they don't have the funds to hire someone. I should say, disclaimer, I'm not sure if our city does that, but it's always worth a try to reach out to see if somebody might know someone that will do a favor to. But again, it's really, in snowfall, it only happens, we don't see these big storms all the time. So especially for people who aren't active and they're not out there working out every day, to go shovel snow, it seems like a light duty, but it's really not. It's very strenuous on your heart.
You know what someone had used, and I don't know that it was used during this storm because again it was so much, but a leaf blower, and blowing the snow away doesn't require the exertion that shoveling does.
Yes, because you would just be holding that. That's the good observation. Yeah, that could definitely help some people.
Absolutely. Okay, back to how does shoveling affect the heart?
Yes. And so when people are shoveling, it's largely a standing still activity because you're standing in one place and you're continuing to get that snow up. So the limited leg movement can cause blood to pool in the lower extremities, reducing the return of the oxygenated blood to your heart.
I found that fascinating.
Yes. Because you think of it, you are moving out there, but when the snow, especially what we just had in New England, how high it is, it's a very strenuous.
And you're in one place for a while.
You are. So that your legs, make sure you're moving those legs when you're out there and not all the focus is just on your arms.
So with that said, it probably makes sense to maybe move back a bit, take a few steps back, and then walk to where you were shoveling. Again, just to kind of increase the movement in your legs.
Yes. Pacing yourself is the biggest thing. Give yourself a break. And when we get into the symptoms for the cardiac events, like if you notice anything, stop immediately. We'll go into what to do. But
don't push through it.
Yeah, don't push through, especially chest pain. You never want to push through chest pain. Yeah, and then it's also important to know too, because during these storms, how cold it is outside. Breathing that cold air causes your blood vessels to constrict, which significantly raises your blood pressure and narrows your coronary arteries, which are already really small. Like your coronary artery is about the size of a cooked spaghetti string, if you think of that. So it's not only like just being in the cold air alone is already increasing your cardiac output.
Something I didn't know. It makes sense, but certainly a concern.
Yes, yes.
Let's look at individuals at increased risk.
Yeah, so anybody can be at risk. The difficult thing is with cardiac, a lot of people might not realize they have cardiac issues and they might just, well, I've always shoveled, so I'm just going to do this. If you have any of these risk factors or have a history of cardiac events, it is really advised to not go and shovel. You should hire somebody else to do it. The effects of snow removal are particularly concerning for individuals with existing cardiovascular risk factors, which include a sedentary lifestyle or obesity, current or former smoker, diabetes, high cholesterol, high blood pressure, history of heart attack or stroke, and a history of any cardiac surgery, so like bypass surgery, coronary angioplasty. So individuals with those risk factors should really don't take the risk. If it's a light snow and you feel comfortable getting out there and you're using your legs and you're pushing the snow, that may be okay for you. Just monitor yourself and pace yourself. But if again, these big snowstorms in New England, we'd like there's a lot of jokes out there that no snowstorms too much. They are. It doesn't matter how many times we've been through them. It's heavy. It's a lot on your body. Don't take the risk, especially at a time when the streets are full and it's hard for first responders to get there.
And I know shovels have evolved over time and actually have become easier to handle. There's, first of all, they're all built of plastic now. Years ago, they used to be metal, so
Yes.
that was an added weight. But some actually have, I guess, an extra handle where
Yes.
the handle is almost a double handle. And I think that it makes it easier on that person's body, maybe the
Yes.
back for that. But all the same, exertion is exertion.
Yes, yes. So that's why it's so important to know your history and don't push yourself. Don't risk. It's not worth the risk a lot of times.
Eventually, it will melt, right?
Yes, yes.
Identify the symptoms now of a heart attack.
Yeah, so we'll start with heart attack because this is what we most often see with shoveling. So knowing what to look out for. So with a heart attack, we see chest discomfort. So it can most times be in the center of your chest that lasts more than a few minutes, or it goes away and comes back. It can feel like an uncomfortable pressure, squeezing, fullness, or pain. So a lot of times we overlook that. Like if you have a fullness in your chest, you're like, oh, it must be anxiety. Especially if you have increased risk history and you were just out shoveling. When in doubt, call 911 or even just your primary care provider just to say, like, this is what's going on. Although in a snow emergency, your primary care is probably not the best.
Right.
911 always.
Okay.
Also, you may see discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach.
Now, a lot of folks would, I guess, know, or it's pretty common, that the arms, pain in the arms could indicate a heart attack. I wasn't aware that the back, neck, jaw, or stomach
Yes.
are involved too, or could be involved.
Yes. So that's why, especially if you have a cardiac history, it's why it's so important to maintain your annual appointments and just be aware, because you don't want to put yourself at more risk. Because that's all we have is our bodies and taking care of our bodies. So.
The other thing I'm thinking too is that don't overdo it. You don't have to have a clean, super clean yard.
Yes.
Just enough where your car can get out and where you can walk to get your car out.
Yeah.
It doesn't have to be pristine.
Yes, and it is, like, shoveling is important. Like, it has to be done, because if you do have, during a snow emergency, you have an event inside your home, but your home is not accessible, yes, first responders will climb over the snow to get to you, but it's a hazard.
And it's time consuming for
And
them.
Yes. But that's why it's so important to know these different symptoms.
So shortness of breath.
Yes, shortness of breath, that can be with or without chest pain. Other signs might include breaking out and cold sweats, nausea, or lightheadedness. And I also just wanted to note with this, women can often show different signs. So they may have these same signs for heart attack. But some women having a heart attack describe an upper back pressure that feels like squeezing or a rope being tied around them. Women may have other symptoms that are typically less associated with heart attack, including anxiety, shortness of breath, upset stomach, pain in your shoulder, back, or arm, or unusual tiredness or weakness. And it's tough because it's so easy to just overlook this.
Well, my thought is, okay, so you haven't been exercising, I suppose. You're out there shoveling, and you might just attribute these pains to, well, they're muscles I don't use very often.
Yes. And now even like with the tiredness, like you just shoveled.
Right.
That might be why you're tired. But it's why it's so important to realize your risk factors and like where your cardiac health lies. Because for the people who are active every day, they go out on walks and all of that, typically you are able to do this activity. You might be tired and lay down, but know your risk history, because you might, if these symptoms arise, it's very important to call 911 to at least rule it out.
And with that said, follow your yearly, I suppose, wellness check with your
Yes.
doctor, because often it may be during that check that an EKG
Yes.
is used, or you may, or it may not be during that visit, but a subsequent visit where
Yes.
that is read.
Yeah, and those annual visits, they're obtaining information to assess your risk history, to see if you were a smoker, to see if you have high blood pressure in your family. So there's a lot that doctors are looking out for in those annual appointments, and it's why it's so important to maintain and still go to take care of yourself.
Something before we get to stroke, for the symptoms of a stroke, how important is it to hydrate yourself while you are shoveling? And cannot hydrating your body cause joint pain or muscle pain?
Yeah, so with the dehydration, your whole body needs water to function properly.
And if you're out there for 4 hours,
Yeah.
you might not be getting that drink that you would normally get if you weren't shoveling.
Yes, so it is important to get in there and make sure you are hydrating as well, because that's just a dehydration on top of your body's exertion shoveling. You don't want to mix those two together. Just as with alcohol, you do not want to mix in alcohol while you're shoveling. But the water, I do think when you're pacing yourself and you're taking your breaks, it's a good time to take a couple sips of water.
And
stay hydrated.
probably not cold water, probably room temperature.
Yes, room temperature is supposed to be better because your body doesn't have to use the energy to cool it down.
Yes, I think you must
Or
mention
to
that.
heat it up, I guess. Heat it
right.
up.
No,
said
I think you mentioned that in the
incorrectly.
previous show, so I'm like, oh, I think
Yeah.
I'll bring that up now. It seems
Yeah.
appropriate, so smart. All right, let's identify symptoms of a stroke.
Yeah, so stroke, to spot a stroke, you want to think of FAST, F-A-S-T. So you look at face drooping. Does the person's one side of the face droop down? You can ask the person to smile. Arm weakness, is one arm weak or numb? Ask the person to raise both arms and see if one is kind of drifting off to the side. Speech difficulty, they'll have slurred speech, or they're unable to speak, or hard to understand. So ask the person to repeat a simple sentence like, is the sky blue? And if they can repeat it correctly back to you. And don't ask them questions that you don't know the answer to. Ask them to repeat a statement. So you don't want to be asking them questions because they might be able to answer them and you'll just be confused.
Right, exactly.
And so T, time to call 911. If a person shows any of these symptoms, even if the symptoms go away, call 911 and get them to a hospital immediately. Also with a stroke, call 911. Don't drive yourself. Don't have somebody drive you, because first responders, when they arrive to the scene, they can give you a medication on the spot if a stroke is suspected, because a lot of times those medications that can help you in a stroke they are time sensitive. So if you notice these symptoms, don't wait an hour, don't wait till your husband comes home, call 911 and go. I think we're so used, a lot of us in our society, we're so used to taking care of others that we're so easy to overlook because you got tasks at work and home and
It might pass, is what we say.
yeah, and it might go away. You might not think anything of it. Doesn't hurt, especially if you have those risk factors. Check in with your doctor.
And again, those identifying symptoms of a stroke, it's FAST. It's F for face drooping, A for arm weakness, S for speech difficulty, and T, time to call 911.
Yes, yes.
Okay, identifying symptoms of cardiac arrest.
Yeah, so cardiac arrest can also happen. So where a heart attack is a blockage of the blood flow to your heart, cardiac arrest is an electrical malfunction of the heart. So with cardiac arrest, and cardiac arrest can happen to anybody at any time, any age. Symptoms, the scary part about cardiac arrest is there's no symptoms to make you think it's going to happen. There will be sudden loss of responsiveness. So if you see somebody fall down, especially if you have a loved one that's out shoveling while you're inside, check in on them as well, because God forbid if they were to collapse, it's time sensitive. So you would want to go up to the person, tap on them and like shout their name, and if they're not responding to you or if they have no normal breathing, so the victim may not have normal breath, when you tilt their head back and check for at least 5 seconds. So if somebody's going down, what you want to do is call 911 right away and start CPR. I do think it's very important. Healthcare professionals, we are mandated to be CPR certified. But for the lay rescuer, so that is anybody not in the medical field, I advise take a CPR class, or at least look on the American Heart Association. What they have, it's called hands-only CPR. So what you do if you see somebody collapse, you check to see if they're responsive. If they're not answering you, dial 911 and just start pressing hard and fast in the middle of their chest. It's not the full CPR that you'll learn in a course, of course, but this intervention really helps that blood flow, that blood that is oxygenated in their body, it maintains that blood flow. And when we're not pumping, it gets very stagnant and it's hard to re-up it. So you want to make sure if somebody's going down, check to see if they'll answer you. If they don't, hard and fast 911. I like to say too, with 911, luckily we have cell phones now. A lot of us have them on us at all times. So that is a good way to dial 911. You can dial 911, put it on speakerphone and just put it next to you. Or if you're with other people, tell somebody else to call 911. But even with that advice, if it's a crowded restaurant, I would say, Mark, dial 911. Because if I say somebody call 911, everybody thinks somebody called 911.
Right.
Yeah.
So be very specific.
Yes.
And one of the things I'm thinking of too, if you're out there shoveling snow, kind of, I suppose, assess your surroundings in the sense that notice other people out there shoveling. And if someone goes down, you'd be in a better position to be able to help them.
Yes. And this is where our communities come into play, because it could be a neighbor who has family that lives out of state, so nobody's checking in on them. So it's a good time to look, again, assess who's outside, make sure you're keeping tabs on them the best you can, so that way if somebody went down, there's a person to respond.
I guess in the next 4 minutes, I'm sorry, we're going through this rather slowly. That's my fault. Steps to make snow removal safer.
The biggest step I believe that's very important is if you have a known or suspected heart disease, hire somebody else to remove your snow. Don't take the risk. If you do need to shovel, begin slowly and work at a steady, manageable pace. So taking those breaks, drinking your water. Make sure you're covering your mouth and nose, dress in warm layers, and be sure to wear a hat and gloves because a lot of our heat leaves from our head.
And you already spoke about the problem of breathing that cold air in.
Yes, it's already a lot on your cardiac system. And this is also, I didn't get into it in this episode, but there's also the risk of hypothermia out there as well. So definitely make sure you're dressed appropriately, which can be tough because you get hot. So then next thing you know, you're in short sleeves out there. But make sure you're monitoring yourself. When possible, push or sweep the snow instead of lifting or throwing it, as that requires less physical strain. Take extra caution on windy days, as the wind can make temperatures feel significantly colder and increase the impact of cold on your body. And then consider using a powered snowblower instead of shoveling. While you should still pay attention to how your body feels, research does show that the use of snowblowers raise the heart rate to about 120 beats per minute compared to approximately 170 beats per minute when shoveling.
Okay.
So it's less
There's a
strenuous on
difference.
the body. Yes. It is still strenuous though. So again, know your history and don't try to overexert yourself. It's not worth the risk.
And we had mentioned leaf blowers as a possibility as well. And snow blowers, though most, if not all, are self-propelled, that does take exertion on the part of the operator to a degree.
It does, yeah. So you're still out there in snow, and especially when you get 2 feet, walking through that snow takes a lot of work on your body.
You're right, even just walking through 2 feet of snow is an exertion.
Yes, yeah. So it's not a light task, although you think of light, fluffy snow. It can cause a lot of damage. So make sure you're looking out for yourself, looking out for your neighbors, your loved ones, staying safe.
We could end on that note, but instead of doing that, or I guess in addition to that, let's talk about the resources.
Yeah, so all of the information today is from the American Heart Association. So their website is heart.org. And they have so much information on there. They have resources you can reach out to. Yeah, so definitely take a look if you needed more information.
Very good. Well, as I had referenced, a packed half hour here, great information. Thank you so much, Caitlin, for deciding on this topic. Certainly timely.
Yes, thank you so much for having me back.
Absolutely. Until next time?
Yes.
Okay. And thank you at home for watching, and please remember to support the local access station in your community for programming just like this. Stay safe.